Assalamualaikum team. I'm Muhammad Haziq bin Muhammad Zudaidi. I'm in charge of bed 12. I'm reporting to critical change in patient condition that's respond with focus and amanah inshallah.
Okay. Waalaikumsalam. My name. Yes, I am Ilham. Go ahead, Aziz. I'm listening.
Okay. The situation is Mr. Ahmad, 58 years old, suspected inferior ectomy is deteriorating. His chest pain is suddenly increased from 3/10 to 7/10. He is sweating more, restless and short of breath. SPO dropped from to 90% on 3 liter oxygen.
Subhanallah, that's quite a lot of drop there.
Yes. So he was admitted for sudden crushing chest pain, radiating to the left arm jaw. ECG showed ST elevation in the second, third, and AVF. Troponin is elevated. Morphine, oxygen, nitro, aspirin is protocol is done. Medical history for this patient is he has uncontrollable diabetes, hypertension, hyperlipidemia, and he is a smoker and no known drug allergy. Yes. So he told me earlier, nurse, please pray for me. I want to see my grandson. Okay. So that remind me, we are treating not just a body, but also the soul. Ihsan is mean when we give care as if Allah is watching us. Okay. So the current medical condition, his vital sign is BP 170 over 100. Heart rate is 180. Respiratory rate is 26 and SpO is still dropping. ECG monitor show frequent PVCs, primarily from the earlier nitroglycerin didn't last. So
his ischemia is worsening.
yes. Okay. So time is myocardial, every second is calm. So I recommend we increase oxygen to 6 liter via face mask, and then we start IV GTN infusion, and we also need to repeat 12 lead ECG immediately. I will notify the cardiologist or urgent PCI.
Okay, I see. I will take note about that.
Alright. Shazwan, can you increase the oxygen now and prepare GTN infusion? Ilham, I will contact the cardiologist and update the CCU preparation.
Yeah, sure.
Okay, may Allah is this.
Thank you, Kim. We'll make effort. Kita berusaha. Allah yang menentukan hasilnya. Let's continue with ukhuwah, compassion, and excellence.
Okay.
Tutut. Hello, I'm Ilham from team leader from Ward 7. I'm calling to give a handover for a patient who needs to be transferred to HDU. Are you the receiving nurse?
Yes, I am Nurse Haziq from HDU. Please go ahead with your handover.
Okay, I'm calling about Mr. Daniel, a 60 years old male with pneumonia. His oxygen saturation has dropped to 88% despite being on 6 liter nasal cannula.
Yes.
He's now requiring close monitoring and possible escalation of oxygen therapy, which is why are we transferring him to HDU.
I understand. What else is happening with him now?
He was admitted 2 days ago with shortness of breath, fever, and productive cough. Chest X-ray shows lower lobe pneumonia.
Okay.
He has a history of hypertension and diabetes and no non-drug allergies. He has been on an IV antibiotic for the past 48 hours. His condition worsened this morning with increased work of breathing and reduced oxygen saturation. On assessment, he is alert but tachypneic with respiratory rate of 28 and have right branula intact. His blood pressure is 150 over 90 past 110, temperature 38.2 Celsius. Lungs shows crackers on the right side, and current oxygen saturation is 88% on 6 liter nasal cannula. He is unable to speak full sentences without pause to breathe.
Okay. I have also checked his IV line is clean and functioning well.
Okay, my team member already checked his IV line and is clean and functioning well.
Okay, no.
So I will recommend to transfer him HDU immediately for high flow oxygen therapy and continuous monitoring. Kindly prepare oxygen support upon arrival and
Okay,
please
noted.
notify the medical officer in HDU if his condition wasn't during transfer.
Alright.
Okay.
Okay, we will start the transferring now.
Okay, I will bring his medication chart and latest veterinary reports. Okay, bye. Thank you.
Yes, Assalamualaikum, good morning. So my name is Shazwan. I'm the recovery nurse for our patients, Mr. Aiman Hakim. So I'm going to handing over you as the receiving ward nurse. May I confirm your name first, please?
Yes, good morning. My name is Ilham. Yes, I'm receiver from Ward 7.
Alright.
And
So
I am Nurse Haziq, team leader Haziq.
together with him.
Yes.
Alright. So this patient has just undergone a bilateral tonsillectomy under general anesthesia, and alhamdulillah the procedure went well, and he is currently stable, awake, and maintaining his airway well. So the pain score is 4/10, and there's no active bleeding at the moment.
Sorry, active bleeding or bleeding?
There's no active bleeding at the moment. Yeah. He is a 12-year-old boy, admitted for recurrent tonsillitis, no drug allergies, no significant medical history, and no bleeding disorders. Intra-op was uneventful. He received IV dexamethasone 4 mg and IV paracetamol 500 mg. Estimated blood loss was minimal, around 20 to 30 mils.
What?
Like that.
Can you repeat?
The blood loss
Okay.
was minimal, around 20 to 30 mils
Alright.
throughout the
I see.
procedure. No drain inserted. Parents have been informed earlier, and then they just express hope for smooth recovery lah, inshallah.
Okay.
So latest assessment, the vital signs is the BP is 104/66. The
Okay.
heart rate is 92 beats per minute. Respiratory rate is around 18 to 20 per minute, and the temperature is 36.6. So the SpO2 is 98% on room air. He is alert and breathing comfortably. Throat is clear with no fresh bleedings. IV cannula in his right hands is clean and functioning well. Fluids running D5 at 50 mils per hour. He has no nausea or vomiting so far.
D5
And-
half saline, right?
Yeah, I'm sorry. D5 half saline at 50 mils per hour. He has I also remind him to say Bismillah and breathe slowly lah, so that he can not feel anxious about his condition right now, and then he respond well lah. So for wardness, please continue to monitor his airway closely for any signs of fresh bleedings, and monitor vital signs every 30 minutes for 2 hours first, and then just continue for hourly. You should remain NPO for the next 2 hours. If stable, he may start code clear fluids later. If pain score is above 6/10, IV morphine 1 mg BRN is charted. Okay, take note about that. And then if there's any bleeding, frequent swallowing or sudden distress, please notify the ENT/MO immediately. And lastly, I've reassured the patient and remind him that recovery is a process, and we do our parts while tawakal to Allah. So, do you have any more questions before we proceed?
Okay, you can proceed to transfer patient for me for the ward. Okay.
Alright, thank you.
Okay.
Okay, for our conclusion today, for using ISBAR to transfer patient and after receiving patient, so I can conclude that from my perspective as in charge nurse, using ISBAR had been received clear structured information from the team from the team leader. It minimize my confusion and also team member and support rapid decision making. And also from an Islamic perspective, this structured communication is a form of amanah to ensure we handle patient information trustfully and responsibly.
So for me, especially for me, ISBAR guide me to deliver a relevant and concise information, especially during the critical moment. Okay, so I realized that good communication is not only a clinical skill but also an act of ihsan. Doing our job with excellence for the sake of patient safety. So this experience remind me that each life is trust from Allah, and we must guide it as mentioned in the Maqasid Sharia. preservation of life is so important for the human. Okay, so that's all for me.
Okay, so for the last one, on the part of the team member, I learned the importance of supporting the leader with accurate data and being proactive. Applying Islamic values helped me remain calm and patient-centered. And showing compassion, will guide how I update and reassure the patients during the process. And that's a reflection for us. I think that's all from us. Thank you so much.
Right.
See you soon.